for giving me this opportunity. At the last moment, I approached Dr. Neeta for a slot, so she kindly gave me this. So this is my title, Role of Patient Engagement in Improving Patient Compliance Towards Monitoring. Patient compliance is a much softer word in any treatment. So this is my topic. These are the brief contents. Before going to the background, multiple studies indicate that the patients get demotivated or when they don't see any significant improvement in their HbA1c levels. Not particularly HbA1c levels or any disease, and get less concerned with diabetes management. Such patients' adherence can be improved with patient engagement programs to educate and motivate the patient towards the advantages of adhering to the regular monitoring of glycemic levels and treatment. And in this context, I want to present this patient that was developed by our IT team. This is an IT-enabled program where we send mobile messages to the patients, educating them or motivating them to come and giving their test. So this is a mobile phone messaging. This is an inexpensive way to educate about lifestyle modification and motivate to adhere to the diabetic monitoring. So yesterday we had a very interesting sessions on disadvantages or challenges in using the media or like a social media network or any technological advance. Of course, there is another side of the technology where we can use this technology to reach to the patients, to educate them and to motivate them. So before going to this, I would like to touch upon what does any guidelines suggest about the testing. At least 2 times a year in patients who are meeting treatment goals and who have a stable glycemic control. And it should be preferably 4 times in patients whose therapy has changed or not meeting glycemic control. Particularly, this is a so here we can see approach to individualization of glycemic targets. This is the patient preference. If a patient is highly motivated or excellent or self-care capabilities are there, it can be where more stringent A1C goals can be targeted for those patients. When the preference for less burdens therapy, then the less stringent. So unlike many direct methods where doctors can have a direct contact with the patients and explain them what is the need and requirement for compliance of a management or any treatment, in indirect methods where we don't know like how the patient's preference is and what are the different reasons why they are not coming back to a doctor or any lab to give their test. So we did a very brief analysis of our data. So according to the HbA1c, there are 4 different categories: intensely control or good control or poor control or very poor control. So this analysis shows that severity of diabetes is a major driver for any patient's visit to a doctor. Particularly in poor control group, this group more frequent than the ones with intensively controlled. Or on the other side, very poor control group establishes that patients get demotivated or whatever be or many other reasons when they don't see any significant changes in their HbA1c levels and may get less concerned with diabetes management. Despite high levels, they tend to miss their appointments and dosing schedules and return only when they suffer from complications. This is the patient visits to the doctor. And what about the monitoring? So this is the initial analysis of a patient's behavior towards a monitoring. So this is a group of patients who have given their test in continuously for 3 years. So this is the first visit, and these are the patient group who have come for more than 1 visit, that is maybe 2, 3 or 4 or 5 times. So this particular group continues here and continues to come for a test in 2017 and 18. And these group who are more than 2 visits, so these are the groups. So in 2016, about 60% of the patients visited for at least once in a year to give the test. On the other hand, only 40% of patients came for either 2 or more than 2%. 2 times to give the test, and this percentage is more or less the same in the third year. However, it is in the second year there is slightly less percentages moved to 2 visits. So in another way to put it, so these particular patients who are continue to visit at least once in a year to give the test, and either one time or more than 2 times. So we put these two groups into a consistence that gives around the 60% of the patients are willing to give the test at least once or twice a year. And this particular group, this is the middle of this. So these are either giving either once or twice a year. That means they are very flexible. So about 61% are consistent or intractable, and 40% are flexible. So our idea is, if this flexible group who are visiting these labs or giving this test, what if we engage them using any reachable, like patient reachable technology to make them give the test and adhere to the treatment? How is the improvement in those patients? So there are different types of to engage the patients. For suppose it can be a treatment compliance where they have to visit the doctor, or medication regularity and timely taking of the medication, or a monitoring compliance. That means they are checking their HbA1c level or glycemic control level at the labs by visiting the labs, or at home, like self-monitoring blood glucose, or towards any lifestyle changes or educational thing. So out of these things, the topic that I am choosing is a PE in monitoring with what real world evidences suggest. Because before conducting this, preparing this slide, I did a literature search. There are quite a good number of studies were published. So this is one interesting study published by Dr. Ramachandran. They did the engagement of patients by sending a mobile messages. They conducted this study in the year, and they published the results in 2013. After 3 years of time, they did the same study with the same patient groups without sending any messages, just to see how they have adhered to the lifestyle modifications or any treatment changes. Very significantly, they have observed, like whatever the engagement they have given in this particular year, they also continued after 3 years of time. This is in the prevention of a pre-diabetic patient pool. So, but the challenge is here, unlike in RCTs, in the real world conditions, there is no these are the uncontrolled conditions. The complaints may vary and subjective matter. In RCTs, control studies where patient behavior can be closely monitored and patients are also aware about the study. Even if we have given so complaints is relatively high, but in normal general conditions, the patient's behavior is not very much likely. So here the most challenging things are mode of engagement, because most of the times whenever we say a printed leaflet or a material is read by the consumers, this is hardly 20% of patients would be reading these materials. So what is the possible solution is IT enabled tools, where we will be sending a mobile phone messages. This is a very simplified and scalable, minimum resources and maximum effect, personalized message engagement, that depending on the patient requirements, we can customize these messages and the reachability. And the second is limited and or not sufficiently engaged. We can increase the intensity and frequency using patients' lab visit data or to engage patients. And the marketing centric messages, this is the most heard one, because most of these messages patients are not interested, because they will be mostly of a marketing. We come to visit our lab and we will be giving this discount. But unlike that, this balancing the content of with educational, engaging and marketing components. And the last one is the follow-ups, how negligible tracking of health records and patient satisfaction rates. This is an automated system, what we have developed to track patients' complaints, requirements and satisfaction, and implement these observations in the follow-up cycles. So this is the patient engagement program. This is a state-of-the-art, fully automated and self-learning personalized patient care and engagement engine. So this is how we prepared it. Creating a, for example, we create a cohort model and we create a patient engagement messages where a medical doctor and a pharmacist are involved in creating messages to understand the patient requirements here. So, and the IT engineer will be developing the tool, software tool to send these messages in a group level or a community level. And of course, there will be some 10% of marketing thing will be there, where we will be offering some discounts to it. And this is a personalized outreach. This can be a personalized message at the individual level to a group and to a community. After that, the patient will be coming and giving the test. We will follow the patients whether they are coming and giving the test, and they are recording their values. And accordingly, we will take the patient's feedback, and this is a complete cycle of it. So, for example, we selected a diabetes. So this is the three. Mostly, we will be engaging the patients with diabetes who are having a multiple comorbidity risk. For suppose any thyroid or dyslipidemia, we will be engaging the patients on every 20 days. If they are coming for the test, and if they are not coming for the test, we will be engaging them to other comorbidities. So, and then we will be engaging them to the complaints, that is to stick to their medication and monitoring. If they are not regular, we will be doing it for feedback. These are the sample messages. And the sample study results, this is a very brief study. So this is a group I have taken for pre-engagement and post-engagement. We have seen 53% of improvement. When I say this is an improvement, HbA1c levels are either retained at the same number or reduced from the pre-engagement stage. And this is the 47%. So the percentage of improvement is higher the HbA1c level, higher the improvement. And so this is from an unimproved group to an improved group.
Excuse me? Can you finish it up in 15 seconds?
So this is the summaries. Mobile phone messaging is an acceptable and proven method in managing and preventing a disease at par with a direct contact method. Given the scope of leveraging the resources in terms of scalability, optimal usage and cost effectiveness, patient engagement is emerging an alternative and preferred choice to engage and educate patients, especially for monitoring complaints and lifestyle changing. And it's an extensive reachability, high consumer penetration of mobile phones and simplified methodology. It can effectively be implemented in various healthcare management programs for women health, preventive care, non-chronic diseases. So thanking you for your kind attention.